Hi everyone, welcome to Nature's Way of Healing. My name is Dr. Corrine Hall Brown, and today we will be looking at GERD.
The purpose of this video is to promote the understanding and knowledge of various health topics. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment before undertaking a new healthcare regimen. And never disregard professional medical advice or delay in seeking it because of anything you have watched here.
Now, we will be looking at what GERD is, the symptoms that are associated with GERD, and the causes of GERD, and complications that are associated with GERD, and also the natural remedies that we can apply to alleviate some of the symptoms and eventually to get rid of GERD. Now, what is GERD? Now, GERD is an acronym that stands for Gastroesophageal reflux disease. That's what it stands for. Now, what is it really? GERD is a weakness in the esophageal muscle that connects the esophagus to the stomach. Now, GERD occurs when acid, hydrochloric acid from the stomach, regurgitate into the esophagus and wear the esophagus down. So therefore, you experience inflammation, irritation, and also you're going to see symptoms that looks very similar to angina or when you're having a heart attack. And this is very, very critical, and I'm just going to put this warning out right now that if you have GERD by any means, it is very important that you know the difference between GERD symptoms and the symptoms, the intensity of the symptoms that is associated with a heart attack. So that's something that you want to know, the normalcy of the GERD symptoms. So, and we're going to go right into the symptoms of GERD. Now, the symptoms that's associated with GERD includes a burning sensation in your stomach when you eat a meal. And this is usually more severe in the nighttime when you eat. You might have chest pain. You will have difficulty swallowing. You will also have a sensation of a lump in your throat. And of course, we're going to have regurgitation of that stomach acid, which will create a sourness in your mouth at all times. So these are generally the symptoms that are associated with GERD. Now, if you have GERD at nights, during the night, now what you will find that it will be complicated by, you will have signs of laryngitis, you will have worsening case of asthma, you will also find that you have constant coughing, and with all of these, you're going to be experiencing disruptive sleep, so you wouldn't get enough sleep. So GERD is something that we want to do everything in our book to prevent it. Now, how do we get GERD? What are the symptoms? What are the causes of GERD? Now, GERD occurs when we have constant acid reflux. So acid reflux is occurring constantly, which means that you're having hydrochloric acid that is pushing up into your esophagus. Now, when you chew food and you swallow it, the food is masticated in the mouth, and then it goes down in your esophagus, and once it goes in the esophagus, you're going to find that right at the end of the esophagus, it's called the lower esophageal sphincter muscle. That muscle is very weak. And what it does when you swallow the food is that it relaxes and allows food to go right into the stomach. Now, what happens from time to time? This abnormally relaxes. And when it relax abnormally, you have stomach acid going right back up into the esophagus, and that cause actual burning of the esophageal passage. The whole passage closer to the stomach will be burned, which means that the mucilage that is present there is gone. So it's a worn area, and this area is constantly inflamed. So you're experiencing inflammation all the time as a result of this. Now, esophageal, this GERD is complicated. The risk factors, there are some risk factors that is associated with GERD. The risk factors associated with GERD include obesity, pregnancy, bulging on the top of the stomach, connective tissue disorders such as scleroderma, and delayed emptying of the stomach. Now, there are some factors that really aggravates GERD, and this includes smoking. So if you're smoking, you would need to stop if you have a condition like GERD. You have drinking beverages such as coffee and alcohol. That complicates it. Eating very late at night and eating very large meals, and also eating fatty or fried foods. And you will also find that GERD is complicated by consuming medication or taking medication such as aspirin. So those are things that really aggravates GERD. So if you have GERD by any means, these are some of the changes that you would need to make in your actual lifestyle. So your diet and when you eat and the amount that you eat. So these are the complications that are associated with GERD. Now, we're going to move right into the natural remedies that are associated with GERD. Now, because GERD in itself is really a lifestyle disease, it can be, the symptoms that are associated with it can be alleviated to a great extent, and we could literally get rid of it by just transforming our lives and doing what is required. Now, your nutrition is the first thing in the laws of health that we look at in most of or all of our presentation. So nutrition is very important. So we must change what we eat. As I said earlier, fatty food, greasy food, anything that is fried is going to aggravate GERD. So that's something that we will want to take out of our diet. Now, eating too late in the evening is absolutely something that we have to eliminate totally in order to get rid of GERD. We would want to eat at least 3 hours before bedtime. 3 hours would give the stomach enough time for whatever is in it to go down into the lower, because it takes approximately 4 hours for food to leave the stomach. So it stays in the stomach for 4 hours. So we want to eat very early. Now, there are other variables that we would need to pay attention to. So we can take things, and I don't like the fact that, there are some things that we will take as Band-Aids just to stop the burning sensation that we experience at that moment. So there are things like baking soda that can be used that is very alkaline, and it's going to change the pH of your stomach. And remember, we want our stomach to be acidic, and the stomach being acidic is not the problem. The problem lies in the fact that the sphincter muscle is very weak, and it is relaxing abnormally and allowing liquid to go back into the esophagus. So we want to actually be mindful, get to the root of the problem. eat very early in the evening. We must drink our water 2 hours before we eat or 2 hours after. We want to make sure that we're not eating and drinking at all, because if we're eating and drinking, it's going to complicate and make the situation worse. Now, when it comes to herbs, we can use something like peppermint. Peppermint is very, very good in alleviating the inflammation that is in affecting the esophagus. Peppermint is one herb that we can use. Slipper elm is also another herb that is extremely good in coating. It has a lot of mucilage in it, and if you're drinking slipper elm, it's gonna provide a coat on that area of the esophagus that is inflamed, and that inflamed area will not be exposed as much to the to the acid when the reflux occur. Okay, so slipper elm, ginger, and the good old ginger, which we have talked about so many times, is an anti-inflammatory herb, and it has that buffer. As I said before, it is both a stimulant and a calmative, so it is very good in reducing inflammation. And chamomile is also good. Anything that is bitter is very good to alleviate any stomach problem that we experience. So a bitter herb like golden seal is very, very good for that Gerd that we experience. So you have golden seal, you have Cascara sagrada, that is a bitter herb that can be used. Now, all of those are aloe vera is extremely good, and we're going to use aloe vera in a combination that I have put together for you guys specially. So aloe vera is very, very good in enabling cell-to-cell communication. So it allows cell-to-cell communication. It provides coating. It has mucilage, and it is extremely good in the healing process of that inflamed area of the esophagus. So aloe vera is extremely good. And eating fruits is also very, very important. So, and one fruit that really helps in alleviating the irritation on the walls of the esophagus is bananas. Apples are also extremely good. So you could slice a whole apple and eat that later on in the evening, and that will help in reducing that inflammation. Now, you could make a tea from your chamomile flowers, a tea from peppermint, and you could add some golden seal to that, and that will help. Now, we're going to do a formulation using this is Irish potato juice, so this is the juice from it. And this provides excellent coating for the walls of the stomach and the esophagus. So it's not just good for the esophagus, but it's also good for any stomach issue that you are experiencing. So we're going to use some of our aloe vera gel. So we're using aloe vera gel. We're going to use 1 cup of 1.5 cup of this Irish potato juice. It doesn't taste bad. In fact, it's pretty sweet. And we're going to use a 1/2 cup of aloe vera gel in this, and we're using a tablespoon of slipper elm. And slipper elm is super, super good for mucilage. So we're using 1 tablespoon of slipper elm. And then we're gonna add, we are going to add 1/2 teaspoon of ginger to it. And that is going to be our combination for this mixture. This is going to be nice and creamy. Remember, the aloe vera is very good for inflammation, just like when you have burning on your skin. The aloe vera is used to soothe it. It's the same way that aloe vera is used to soothe inside of our the esophagus or the digestive tract. Okay, so, and the slipper elm is also an extra coating as well. So we're just going to blend these together, and once you blend them together, you can, and we don't have anything that is very hard in there. You could drink 4 ounces of this, and if you're going to drink this, you want to drink this at least 2 hours before you eat anything. So you want to have this 2 hours. So 4 ounces is good. And once you take 4 ounces 2 hours before you actually eat, you will find that the burning sensation that you experience from GERD will be greatly reduced. Okay, now that we did our formula, when you try this at any point, I am imploring on you to tell us how it worked for you. Okay, all the information about this presentation will be in our description box above the like button. And if you like this presentation, you could give us a thumbs up. Now, this brings us to the end of this segment. Now, I have 2 questions for you. One, what does GERD mean? And the second question, you're naming 3 factors that aggravates GERD. Now, you're answering the question in the comment section. I hope that this presentation was beneficial to you, and thank you for watching Nature's Way of Healing.